Good morning, Ms. Makatula. Today we will be discussing about sexual abuse. Sexual abuse or sex abuse, also referred to as molestation, is abusive sexual behavior by one person upon another. It is often perpetrated using force or by taking advantage of another. When force is immediate, of short duration, or infrequent, it is called sexual assault. The offender is referred to as a sexual abuser or molester.
The term also covers any behavior by an adult or older adolescent toward a child to stimulate any of the involved sexually. The use of a child or other individuals younger than the age of consent for sexual stimulation is referred to as child sexual abuse or statutory rape.
What is rape? Rape is a form of sexual assault, but not all sexual assault is rape. The term rape is often used as a legal definition to specifically include sexual penetration without consent. Here are some types of sexual abuse. Sexual assault. Sexual assault can take many different forms and be defined in different ways, but one thing remains the same. It's never the victim's fault. Some forms of sexual assault include attempted rape, fondling or unwanted sexual touching, forcing a victim to perform sexual acts such as oral sex or penetrating the perpetrator's body, penetration of the victim's body also known as rape.
Child sexual abuse. Child sexual abuse is a form of child sexual abuse that includes sexual activity with a minor. This is a harsh life of fact in our society in where an adult forces themselves in engaging physical activities with minors. A child cannot consent to any form of sexual activity. Type of child sexual abuse are exhibitionism or exposing oneself to a minor, fondling, intercourse, masturbation in the presence of a minor, or forcing the minor to masturbate, obscene conversations, phone calls, text messages, or digital interactions, producing, owning, or sharing pornographic images or movies of children, sex of any kind with a minor, including vaginal, oral, or anal, sex trafficking, any other contact of a sexual nature that involves a minor.
Sexual assault of boys and men. Sexual assault can happen to anyone, no matter your age, sexual orientation, or gender identity. Men and boys who have been sexual assaulted or abused may have many of the same feelings and reaction as other survivors of sexual assault, but they may also face some additional challenges because of social attitudes and stereotypes about men and masculinity. The following list include some of the common experiences shared by men and boys who have survived sexual assault. It is not a complete list, but it may help you to know that other people are having similar experiences. Anxiety, depression, post-traumatic stress disorder, flashback, and eating disorder. Avoiding people or places that remind you of the assault or abuse. Concerns or questions about sexual orientation. Fear of the worst happening and having a sense of shortened future. Feeling like a less of a man or that you no longer have control over your own body. Feeling on edge, being unable to relax and having difficulty sleeping. Sense of blame or shame over not being able to stop the assault or abuse, especially if you have experienced an erection or ejaculation. Withdrawal from relationships or friendship and an increased sense of isolation. worrying about disclosing for fear of judgment or disbelief.
Incest. The term incest refers to a sexual contact between family members. Laws vary from state to state regarding what constitutes crimes of incest, child sexual abuse, sexual assault, and rape. Regardless of state laws, unwanted sexual contact from a family member can have a lasting effect on the survivor.
Why is it difficult to tell someone about sexual abuse by a family member? It can be difficult for an individual to disclose sexual assault or abuse when they know the perpetrator. It can be especially difficult if the perpetrator is a family member. What can keep a victim of sexual abuse by a family member from telling someone? They may care about the abuser and be afraid of what will happen to the abuser if they tell. They may also be concerned about other family members' reactions, fearing they won't be believed or will be accused of doing something wrong.
They may have already tried to tell someone what happened, but the abuse was ignored or minimized. They have been told by the perpetrator that what is happening is normal or happens in every family, and they don't realize that it is a form of abuse. They may not know that help is available or they don't know who to trust. They may be afraid of getting in trouble for telling or that the abuser will follow through the threats. Drug facilitated sexual assault. Drug facilitated sexual assault occurs when alcohol or drugs are used to compromise an individual's ability to consent to sexual activity. These substances make it easier for a perpetrator to commit sexual assault because they lower inhibitions, reduce a person's abilities to resist, and can prevent them from remembering details of the assault. Drug facilitated sexual assault can look like coercing or pressuring someone beyond their comfort zone to ingest more drugs or alcohol or different substances than they are comfortable with. Ignoring or refusing to help someone who says they've had too much to drink or is having a negative drug experience and needs help. Initiating sexual contact with someone because they are intoxicated and less likely to resist. Refusing to tell someone what is in their drink or the type of dosage of drug they are ingesting.
Why do people sexual abuse? For the reason that some people may be sexually attracted to children and if they act their feelings out of attraction toward children, that is sexual abuse. Some people may be generally sexually attracted to other adults but may sexual approach children when they are under a lot of stress, like losing a job or getting a divorce. Their often targets are minors, children, and boys. And here are some 5 things to prevent sexual abuse.
1. Educate yourself about the realities of sexual assault. Knowledge can be a powerful tool. Learn who is most likely to commit crimes of abuse, why adult abuse, child, etc. Seek out preventative information about child sexual abuse. Second, get involved and participate in the movement against sexual violence on college. There are many ways you can go personally get involved in the fight to raise awareness and prevent sexual violence in your local community. You can volunteer at a crisis center, stop a hotline, participate in fundraising events, advocate for survivors, help raise awareness and improve safety measures on college campuses, or get creative and host your own educational or advocacy event.
Respond physically and mentally. Be alert to your surroundings and the people around you. By taking a few simple precautions, you can reduce the risk to yourself and also discourage those who commit crimes. Always be alert and aware of the people around you. Educate yourself concerning prevention tactics. Be aware of locations and situations which would make you appear vulnerable to crime, such as alleys and dark parking lots. Always trust your instincts. Going by that gut feeling is often considered risky, but in reality, we all have that ability to intuit and connect the intelligence of the mind, heart, and gut. Everyone has experienced a time when they just knew something even if they couldn't quite explain it. We can develop intuition to better handle the uncertainties of an era of incessant change.
And that's it about sexual abuse. We hope that you learned something about sexual abuse, types of sexual abuse, and how can you prevent sexual abuse.